I said before, tonight was about saying thanks. Thanks to our community groups for entertaining us and working our soul. Thanks to government for the infrastructure and the support that we need to go forward. And particularly to say thanks to our first responders, to our professional and volunteer emergency workers, and a chance for Region to do that more formally. I might ask them to join us on stage, and I'm going to ask them a question or two, but please welcome on stage in no particular order, except how it's written in front of me. I haven't yet declared my fanboy status yet for Kerry. She'll feel you now have to say how much you love Kerry, or you're going to be... but Kerry Chant, Chief Medical Officer of New South Wales. Daniel Austin, the Acting Commissioner, New South Wales State Emergency Service. It's hard to recognise them not in orange overalls, yeah, SES. And Kyle Stewart, the Deputy Commissioner of the Rural Fire Service. Oh, there's your action hero. There's a little bit about the three of these people, and to their credit, when we first asked Kerry and originally, representatives, Daniel's boss, Carleen, used to be our next door neighbour, and all things injured, not fighting floods or anything else SES does, but a more simple but significant whack to the face. She took recently surgery. And the common thread, and also I think originally Shane Fitzsimmons and Rob Rogers, was that we don't want to come along if you're going to just laud us. We're happy to be there if you're talking about the people we represent. And that very much is the case. And I think it's a tribute to the people here that was the base on which they've been prepared to come and be honoured, because they represent both professional and volunteer workforces in some cases. And we wanted a chance to say thank you. Kerry Chant, a girl from Punchbowl, said before, I think I dobbed her into the media when government was doing it tough a bit. I looked up on Google, as you do. And I said, she's from Punchbowl. I said, why aren't you buggers saying that? Keep all us Westie advocates who are yelling at you at bay. And they pretty soon did. Suddenly it was, Kerry's from Punchbowl. It couldn't be bad. It must be right. She's from Western Sydney. But Kerry's was named last year as the State's Woman of the Year. I think that limits you, Kerry. I don't think whole person of the year, not only Woman of the Year, but quite remarkable. And I think the partnership she formed with Gladys Berejiklian, who could forget the 11 a.m. every morning appearance, was quite remarkable. And those of us who watched politics for many years marvelled. I remember the Premier's then Chief of Staff saying, I can't believe people are just doing what we tell them to do. I think it's because Kerry's asking them and they're all saying they have to. It was quite a remarkable thing of civil obedience, and I think even took the most hardened cynics by surprise. And she's been with New South Wales Health since 1991, working in the areas of virus infections, communicable disease prevention, and control Indigenous health. Daniel Austin leads the development and delivery of operational capabilities for the SES. As Chief Executive Officer of the New South Wales SES Registered Training Organisation, he's also in charge of training guys to do what they do, the heroes to do what they do. And Kyle Stewart, the Deputy Commissioner of the Royal Fire Service, has been in that job since April 2021. Prior to this, he was a copper for almost 20 years, not unlike Carleen York as well. He studied criminal justice and law. Why don't you go and become a filmmaker? Filmmaker, fireman, it's very close. Look, we are here to say thank you for a region that has suffered at different parts of it, from the Hawkesbury in the mountains down to Wallandilly, Penrith, all stops in between, the Hills District. Now, we talk about bushfires, floods, pandemic, floods again. In fact, since we arranged this gig, floods came back in. So the SES was back. We didn't in our wildest nightmares fear that we'd be eating into operational time again. This was meant to be after all the fires were out and the pandemic had largely gone and the floodwaters had gone away. But this is a region that has suffered a lot of it, and it has been a remarkable achievement by all of your organisations. Can I start, Kerry, you lead a professional organisation, so not so much based on volunteerism, but as Stewart said before, the type of workers who go toward pandemic, who don the PPE, is that one beautiful new term? We're all experts on PPE now. don the mask at the Capes and have taken this on. You must have done an awful lot of preparation, but no amount of preparation could have, imagine, got anybody ready for what we encountered in the past few years in the pandemic.
Look, I'd have to agree with that. And, you know, one in a 100-year pandemic, most of us will never see it. The dealing with uncertainty, dealing with changing science is a real challenge. And I just want to also say it's not only about those that go to the fire, it's all the back-end people, the cleaners, the logistics, the people that just gave their all. And I'd just like to acknowledge the incredible commitment of the New South Wales Health staff and how, even just talking to Amanda before, just saying how you'd expect people to do something, but they actually gave 250% of themselves to the tasks. And I think I'm just so incredibly proud to be in such a committed organisation, and I know my colleagues share that commitment. But I think we should just remember it's everyone who played a part, and I think it's the strength of the system, but the commitment and passion of staff, because without that, you can't deliver the outcomes. And I think also the partnerships with community. I think, if anything, I actually had the privilege of working in southwestern Sydney, growing up in southwestern Sydney, and one of the things from the pandemic that really resonate with me is just the social disadvantage. I saw that when I worked there, and I think it's so important that we address some of those fundamentals through education, training, business opportunities. That's the bit that tore my heart apart, just to see some of the difficult situations that community members were facing, and how whole of government stepped in to support them. But it would be great that those situations weren't there in the first place, and that's my probably vision for the future. Another
particular thing with that part of Sydney, I have the great honour of chairing the advisory board of South West Sydney Health, and acknowledge what you're saying there. One of the other great contingencies of that area of Sydney is the language issues, and the pandemic. We had, ironically, we'd been looking at that was the next issue on the meeting, the agenda of the meeting we had to cancel when the pandemic broke, was about how do you communicate with coloured communities, not assuming in a pandemic, just normally. What have you learnt from a public policy perspective of that, and people have different views about soldiers and role of police and lockdowns, etc., but just in getting out a nuanced public health message, how difficult is that in places where there's a cultural and language difference to the mainstream?
Look, I think given where we've been, I think we have learnt so much about the importance of effective communication, and it doesn't matter what debrief of what disaster or what event, communication always comes out as one of the things that you need to do better. But I'm actually thinking that the journey through COVID has actually taught us to do a lot of things better, which we now need to incorporate in our day-to-day business. And some of the things that I think were really effective was our work with multicultural health. The fact that our local health districts are grounded in community and already have deep roots into the community. They have local participants on the boards. I think the strength through our schools, our religious leaders, our business community. It's always important to remember there's not just one way of communicating. And I think we have to embrace the diversity, which is southwestern and western Sydney, and just use multiple channels. But I think probably making rules simple, don't change rules. Understand how the rules are.
It wasn't just for you, Stu, I think generally.
How the rules are heard and understood. Test that. And that's really interesting, like policies need to be short, I remember at the beginning of the web saying, look, I've been through this before in 2009. It was a very much more smaller scale of swine flu. Make sure that we don't just put too much content on websites. Then the website, everyone asks questions, and then we end up with documents that are this long. So I think many of that communication discipline, the discipline that a policy is only good as your ability to explain it and for it to be understood, and simplicity. And I'm not sure we got there at all stages. We're still confusing a lot of people now. But my commitment is the next time we change a big policy step, and we're going to have to continue to evolve our response to COVID, and we're probably going to have to do a step change once we get over this next peak. I'll try and put that into practice and make it simple, clear and effective communication so we all understand what the rules are.
And I add to that too, and particularly in the presence of Lisa Lake from Cumberland and Cal Asford from Canterbury Bankstown and Ned, who was here, but then we lost him at the last minute. The role of local government in that.
And I should have, look,
and
apologies.
I know you did, so I don't mean to pick you up on that,
no,
to cement that it became I think local government shone through a period of COVID, and there are times where you can always take a shot at the local council if you're waiting for your approvals or the garbage isn't picked up, whatever. But local government shone through COVID, and I think that connection to community was, particularly in those communities.
That's right, and the other thing was that the local government, local health districts have those links with council, and to leverage off those connectivities. But local council is just such an amazing grassroots organisation, and also has assets to leverage, and we can learn from how they've communicated with their communities, what works, what doesn't work. So I think for me, it's just building on those learnings and trying to bed it into our business as usual activities for 2022. But
perfect segue to the guys that get better uniforms than you get. Shiny epaulets. Daniel, speaking of local government and the partnership, SES, as I said, my father was a local member years ago, and SES was his proudest boast, Parramatta, to be involved with SES. And I think they gave his honorary orange overalls at the time, and it was quite the thing. You've seen, again, you're back in business when we hoped you wouldn't be for a while. Within our window, our sort of 2-3 year window we're talking about, the floods came, and then they're back again. How do you manage a volunteer organisation like that? I know that you're the professional staff within, but there's also an awful lot of volunteers. How do you blend, and it's an issue at RFS, that's an issue, how do you blend the two, professional and volunteer organisations, and why should we have to rely upon volunteers to do the job in the first place?
Yeah, that's a really interesting question in itself. And sorry, Kyle, I'm going to steal the stats that we talked about earlier today. The Australian emergency services sector is made up of around about 225,000 people across the country. Of those, just over 200,000 of those are volunteers. So the reliance on volunteers in Australia is probably unlike anywhere else in the world. And those volunteers are part of your day-to-day communities, potentially the people you're sitting next to tonight, those kind of things. And ultimately, I guess, sitting here as leaders of business and those kind of things, it is actually that level of cooperation and that level of support that ultimately we rely on to ensure that the community, of which we are all a part, gets the service it needs when it needs it. So ultimately, and I've said it in the media many times, it is ultimately one big team effort, and whether that is starting on the what we refer to as the PPRR model, the cycle of emergency management from preparation right the way through to recovery, or it's the provision of facilities, or it's letting people go during work hours, or any of those kind of things. It absolutely is that 100% team effort. And ultimately, there is a saying within the emergency services that professionalism is a state of mind, not a rate of pay. The people that turn up at 2 o'clock in the morning, be it wearing yellow, be it wearing orange, or anything else, are trained to professional standards today that potentially we certainly didn't back when I first started far too many years ago. So ultimately, it is that team effort. It is that need of every piece of the jigsaw puzzle to work together to make this work.
I'm very proud of them. Within Kyle, in terms of communications, in my weekends when I send an Adam Leto, I will get square for the photos. You know, you 2-up-1, I got you last time, I will get revenge. But in far southwest Sydney, spend weekends, amongst a group of people listening to police scanners at 4 in the morning, wondering whether your property is about to light up. For me, I didn't quite have the experience Andrew Constance has, luckily, but to be that close to that fire was quite remarkable. And it's steeled in a community. The same was happening in the Hawkesbury and in Penrith in the mountains. The fire all around different parts of Western Sydney, bushfires, we're not new to it. But there was just something about that process which seemed to change forever, the Black Summer. What's it changed within the RFS? What do you do fundamentally different again? There was the debate around volunteer versus... I'm thinking, why am I waiting on the local plumber to come and put out the fire? Why am I... In the city, they get somebody who's paid fireman. So that challenge goes on. We can celebrate volunteerism, but you can also ask the question of, are we putting enough proper money into professional firefighters?
I'm looking at the clock in front of me, which says I've got
Ignore
exactly 30 seconds to go.
Ignore the clock. Started early.
While I've got the microphone, I think it's important that I too tell a Chief Health Officer anecdote. I found myself in the car with my wife just about 6 months or so ago, and as I have a habit of doing, I was in my own company, keeping myself really sort of trying not to think of anything actually, and my wife has this habit of saying, "What are you thinking?"
They're annoying like that, aren't they?
She twisted the question on me and she said, "Hey, if you could have anyone over for dinner, who would you have?" Hashtag I win. I chose Kerry Chant. So if you can find my wife on social media, can someone take a photograph and send it to her, Joe Stewart? Okay, so why do we rely on volunteers to do what in other jurisdictions paid staff would do? Let me tell you about the dynamics of what the Rural Fire Service is at the present time. So we are the largest volunteer firefighting agency in the world. 75,000 volunteers that serve the men and women of New South Wales, 45,000 of whom are active firefighters. One of the dynamics that you need to consider when you think about what it is, it's the service provision that we provide to the state, is that across the 110 local government areas that we serve, we've got 2,000 brigades. I wonder if state government, federal government could afford that. Quite clearly, the proposition that we pay for that and that we expect that service to be provided by a paid workforce is perhaps kind of counterintuitive to what it is that we're seeking from the community, which is to support one another through whatever it is, it's the crisis that we're confronting. So from a volunteer agency perspective, really important that we, as those who administer the volunteer agencies, certainly undertake an appreciation of what the true dynamics are of the operating environment in which we exist. Now, one of the things that I want to call out, if you consider what the 2019-2020 season was for the Rural Fire Service in the state of New South Wales, 2,448 homes lost, 25 lives lost, and 5.5 million hectares of fire scar across the state. Balance that with what it is that we've seen in this current financial year fire season, which is 100,000 hectares burnt. You get an understanding of what the dynamics were of that particular season. We saw an incredible amount of volunteers providing long efforts of time on the fire line and serving communities, to that very argument around how you compensate volunteers and what it is that you do to support their operations. Well, perhaps the answer that I give to that question can be found in a couple of things that just really quick examples. Local government representatives who are here today, we cannot, as either the SES or the RFS, do what we do without the support that you provide us from a local government perspective. State government, the investment that you have provided into particularly the Rural Fire Service has been outstanding. Now, I know that the Minister is one of those people that pays my wages, but it has been outstanding. In terms of infrastructure, in terms of our firefighting appliances, or whatever it might be in terms of the PPC that we provide to our volunteers. But the philanthropy that has been shown towards our organisation, clear support as well. Need to call out the Goodman Foundation, who provided a $6.5 million helicopter to the RFS, which just this last month was a part of 6 helicopters that Daniel and I were operating that provided 75 flood rescues to the communities in the north of the state. So if you get an understanding of the true net worth of benevolence, of philanthropy and volunteerism. Just in those very few dynamics, you get a true sense of what it is that's the heroes that Daniel and I represent here tonight.
Well, before I ask Amanda to come up and vote of thanks, can I, on behalf of our patrons and our supporters, just it says to each of you, this is to you, it's RFS. Greater Western Sydney says thank you. The certificate is presented to New South Wales RFS. We honour the bravery and professionalism of community firefighters during the Black Summer of 2019-2020. Daniel, to you again we say thank. Greater Western Sydney says thank you to the SES. We honour the bravery and professionalism of emergency services management and volunteers during floods across Greater Western Sydney and in the fires in recent years. My family were evacuated twice from Windsor. Thank you. And to Kerry, to Greater Western Sydney again says thank you. To New South Wales Health, we honour the professionalism and dedication of medical staff and ancillary workers during the pandemic across Greater Western Sydney. Thank you. In asking Amanda Larkin from Western Sydney Health to come up and say thank you to our speakers, particularly to her mate Kerry, can I also thank, as I said, local government workers, but people like the workers at Endeavour who kept the power lines going, our frontline workers, our delivery staff, our construction workers, the contractors that are here, the public servants across the board, our school teachers. It is almost impossible to choose three, but if you've got to choose three, these are the three organisations we particularly go for. But if nothing else, it showed it's appropriate. We can have a discussion around use of funds, etc., volunteerism. There are genuine public policy debates that need to be had, but let none of that take one iota away to all of your teams. Our thanks to all the staff for what they do, paid or unpaid, professional or volunteer. Our region is very grateful. Please welcome Amanda Larkin from South West Sydney Health.
Thanks, Chris. Ladies and gentlemen, it really is a privilege to being given the opportunity to offer the vote of thanks to the three of you tonight. Can I just say on behalf of Western Sydney, to New South Wales Fire, the Rural Fire Service and the New South Wales State Emergency Service that has supported the communities of Western Sydney over the last couple of years, truly you have carried us on your shoulders. And we saw that just recently in the north, can I say to you, when people were literally carried off houses, etc. But over this time in Southwestern, it has been an absolute challenge, but it's with your support and the true resilience of the people of Western Sydney and all of you around the room here that have made us through these last couple of years. And obviously specifically to Dr. Kerry Chant for her unwavering work and commitment to this community. And I want to talk briefly about that. Each of us will reflect on the last couple of years. They have been truly unprecedented times for us. There will be many heartfelt stories. When we look back in health, when people weren't able to come in and be with dying families, when people weren't able to be there when babies were born, many stories will be told of these times. Lots of great research will be done, and Kerry, you know that better than me. Many, many papers will be written, and I'm sure there'll be lots of PhDs written about the last couple of years. And these will be the things that we might remember. But most importantly, I hope we will think about and reflect on the true leadership we have witnessed over this period, not only through government, not only through the great people who sit here, but all of you around the room also. And we need to think through fire, rain, floods, and then a pandemic. And truly, the West has been hit pretty hard in just about all of those different areas. These were times of great challenge and crisis, and these demand leadership formed on courage, steely will and determination. Lots of decisions were made over that period of time. There was no little black book. Someone I was sitting with was saying, was there a pandemic plan? Well, I can tell you, I've got lots of pandemic plans, can I say to you, but not a pandemic plan that fitted this. Have I got plans about how we deal with floods in the West? Yeah, I got one of those too. But these were different times, and it asked for different leadership. Leadership that was willing to make decisions. Weren't always exactly the right decisions, Minister, but we made the best decisions to make sure that we supported our communities and the people that we cared about mostly. So it was courage, steely will and determination, mixed though with great care, compassion and commitment to ensure we got the result we needed. These are the attributes we've seen, and these are the ones that have led us and guided us through these most difficult times. And to each of you, your volunteers and your professional staff that I think in your organisations come together so well. Could I just reflect to you though, I think we have sometimes a bit of standard thinking about what the Rural Fire Service and the State Emergency Services do. I went over to the vaccination or the testing centre over at Fairfield, and I went in this day, and Fairfield Council had supported us, they'd done amazingly, and here are the boys and girls in orange. And I said, what are they doing here? I'm not quite sure what their role is. Well, here they are organising lines, directing traffic, food. Food's always an important one, I've come to the conclusion. But all of that was happening, seamless, not an issue, and everyone worked together. So when we talk about what these services do, it's not this standard thing. They're here for the community and they will adapt to what's needed at the time, and time again they come out and do that. So to Acting Commissioner Daniel Austin and to Commissioner Rob Rogers, you have our thanks, our praise and our sincere appreciation for the work that you and your teams have done. They've done amazing. But it does give me the opportunity up here tonight, because I actually have worked with Kerry Chant for a long time, can I just tell you? And it is great that, Kerry, you've come tonight. Western Sydney really did want to thank you for all the work that you did over this period. And it gives us the opportunity for me to reflect on the important role you've played in guiding us through the pandemic. It is the science, it is the decision making, it's government's role to kind of work out what to do, but you need experts like Kerry to support that. Through these many months, we as a community have come to learn about and understand the great role played by public health and public health strategies that have shaped our lives, people, and you need to think really carefully about them. And when I talk about public health, I'm not referring to the vast array of health services that support and care us with illness and trauma. That's one side of the public health. This is the powerful public health strategies that have fundamentally shaped and changed our lives over many years through prevention and spread of illness and disease. And in health, they kind of sit a bit to the side of the business sometimes. We're all a bit focused on what I call the things that go ping in the night, and we want lots of those because, you know, we can give money for those. But when you think about public health, when you think about what we've been through over the last couple of years, it is the pandemic that has brought us as a community to our knees, and this is what we need to think about going forward. Public health strategies have a long history in our lives, from the institution of sewerage management, and local councils are still involved in all of that today, to the famous thing in health, what we call is hand washing and infection control. And I think I took a breath one day when I was watching the television and the Prime Minister got up there in front of the country and said, everyone needs to wash their hands. I thought, finally, someone has got the point that, you know, infection control is important in our lives. Honestly, I thought this is fantastic. But more recently, the big public health measures and policies include strategies like, if you're, you know, my age, you know, road deaths, you know, the introduction of seatbelts, etc. Prior to that, the trauma that used to come into ICUs, you have no idea about. And I know it's still not great today, but it is so much better than it was. That was a public health strategy. Quit smoking strategies. I can't tell you how many strategies I've been on with Kerry on quit smoking. That campaign started 35, 40 years ago when the evidence was coming through, but it was public health people who fought that battle hard for a long period of time. Gun control issues, work on HIV and AIDS, and the work that was done in the 80s and the 80s and 90s. slip, slop, slap, all the sunburn, all those ones. And of course, childhood immunisation and pandemic management. And look, I could continue. These are the things that really have influenced and really worked on reducing disease, improved our health status, but most importantly in Australia, and unfortunately not for our Indigenous people, but we continue to work on it, but increased our life expectancy enormously over that period of time. So although we focus a bit on our acute care end, it is these public health strategies that really have influenced our lives and our health status over this period. This has been the focus, passion and commitment of Kerry Chant for many years. You couldn't have someone more committed, could I just tell you. A career built in southwestern Sydney in the late 1990s when she led responses to significant communicable disease outbreaks, environmental health concerns. It's always interesting, when I used to listen to estimates, and Kerry would be there talking about this quit smoking campaign, and then we'd flick to the quality of the Georges River water, could I just tell you. I also thought it was interesting that you could kind of do both in one discussion. Food safety issues, and has absolutely been involved in critical public health research. Kerry has a deep appreciation of the community and of the community of the Southwest and the health issues that impact on us, and throughout the pandemic ensured that all our work focused on the communities and groups of greatest need. The things you've talked about tonight, when people couldn't understand, the messages, which were difficult and complicated, and that cut across the cultural issues that were at the heart of the communities that we serve every day. How do we get those messages through? And lots of work and thinking and consideration and collaboration occurred for us to do that. Kerry, tonight the community of the West take the opportunity to offer its most sincere thanks for your steady hand, your consistent guidance and your ongoing and tireless work. You have a truly humble nature. You need to know Kerry Chant. She is a truly humble person. But tonight it is about you, your work, your leadership, through what has been, I think we'd all say, the ride of our lives, can I say? And I'm not in for the next 100 years, Kerry, seriously. I've worked in health a long time. I think all of you truly can be proud not only of our first responders, but the people who have worked in health, who have continued. I said today we're in the fourth wave at the moment. I've got 650 furloughed staff, but people keep turning up and they keep delivering health care. But they really are very committed, a group of people, and are committed to this community, and that's the most important thing. So it has been the ride of our lives, and I know the ensuing memories we will all carry. My sincere thanks.